In October 2019, I stopped taking my drugs for chronic myeloid leukemia, and I've been in treatment-free remission for over 1.5 years.
How did we get to this point? Stay tuned and find out. Hi, I'm Amy.
And I'm Steven. I was diagnosed with chronic myeloid leukemia, CML, in my mid-30s, 10 years ago. I was very lucky that I only had to take pills in order to keep the disease in check.
The first few years after diagnosis, Steven had to get bone marrow aspirations and biopsies, but now, thankfully, he only has to get blood tests to monitor how he's doing.
When I was diagnosed in 2011, my PCR was over 100%. The PCR test monitors the presence of the disease.
He first achieved a 0.00 PCR result back in January of 2015. We put in a lot of effort to help Steven get to that point of 0.00. Along with taking his pills every day, we made sure to focus on having healthy habits in the 4 pillars of health for the both of us. The 4 pillars of health being headspace, eating, activity, and lifestyle.
I started at the maximum dose of Tasigna of 800 milligrams a day, or 4 pills total. As a side effect, I had higher than normal bilirubin, which is a liver enzyme.
Over the years, his doctor kept lowering the drug dosage to improve Steven's bilirubin, and his PCR continued to go down and eventually got down to 0.
The last 6 months of my treatment was just 1 pill a day. I was excited to see that after 6 months of only 1 pill a day, that my PCR had still remained at 0%.
Decreasing Steven's drug dosage was important to getting him to TFR. It was important to his medical team to see that his PCR continued to stay at 0%, even at a lower dose. After over 8.5 years on Tasigna pills, Steven's leukemia doctor was finally ready to let him stop his treatment. This is called cessation or treatment-free remission, TFR.
What qualifies a CML cancer survivor for TFR? Cessation is still relatively new with Tasigna and for CML patients in general. The baseline goal for TFR is to have a 0% PCR for at least 2 years. However, my doctor wanted me to get to close to 5 years because there's a higher success rate of not having a relapse.
People that have a PCR around 0.00 for at least 2 years have a 50% success rate at being able to stay off the drug. For people that have maintained a PCR of 0.00 for 5 years, the success rate is closer to 85%. When Steven stopped taking his drugs, his PCR was at 0.00 for almost 5 years, so his chance of success was high.
According to my doctor, CML patients usually know within the first year if they're not going to maintain 0%. If there is a relapse, patients just go back on the drug and resume getting tested twice a year.
However, the clock resets for another 5 years of taking the drugs before trying cessation again.
While on cessation, I needed to get blood work done more frequently. For the first year, I had to get blood tests and PCRs done roughly every 2 months.
After a year of cessation, Steven started getting labs every 3 months, and his doctor might change his labs to every 4 months soon, which is exciting.
Very excited. I was fortunate that I didn't experience many withdrawal side effects from stopping Tasigna. I think it helped that we slowly lowered the dosage of my drug over time.
The main withdrawal symptoms Steven's care team has seen in other CML patients is muscle soreness. And this usually happens within the first few weeks of stopping the drug.
I didn't experience muscle soreness, but 4 to 5 months after stopping the drug, I started having aches in my hand, kind of like arthritis. This went away after a few weeks.
Steven's bilirubin, which is a liver enzyme, was always elevated in his blood tests when he was on the drugs. Once he went off, his bilirubin went back to normal.
In addition, the hair on my head became fuller again. However, I still seemed to be sensitive to skin issues, and get skin infections more easily, even after stopping the drug. Recently, I have been dealing with my stomach making noises, like squeaky sounds, especially at night. I think it has something to do with what I'm eating, but I haven't been able to figure that out just yet.
One benefit for Steven stopping his drugs is not having to worry about fasting before and after taking his pills. So normally Steven would have had to fast for 3 hours around the time he would take his pills.
That restriction would often get in the way of any mid-morning snack. Now I have been able to snack whenever I want to, which is great. I mean, who doesn't like unlimited access to food? As we have discussed before, health is an everyday practice. We follow the 4 pillars of health: headspace, eating, activity, and lifestyle. We developed habits in each of these pillars that we worked on together every day. Check out the video to learn more about the 4 pillars.
We encouraged each other and held each other accountable. Our daily health routines helped Steven go into remission and stay in remission.
When I was first diagnosed with cancer, I was exercising and had decent headspace, but I didn't get enough sleep and I wasn't the best eater. Over the years, I slowly improved my diet and I started getting more sleep. I eventually added yoga to my schedule, and now I have a strong foundation in all the pillars of health.
Our schedules and routines have been the same since Steven stopped his drug. We make it a point to practice all of our daily habits, our daily healthy habits, in each of the 4 pillars of health. We believe this has been the most successful thing in keeping Steven at 0% PCR.
Yes, I don't do anything different now that I'm off the drugs. I continue to eat healthy, exercise, and stay as relaxed as possible.
According to Steven's doctor, if Steven's PCR is at 0.00 2 years after cessation, then he is cured. We are definitely looking forward to that day.
Fingers crossed.
Fingers crossed, yeah.
TFR is different for every cancer, and we hope you have learned a little bit about getting to TFR for CML and maintaining it.
We're here to support each other and learn from each other. We're all part of Team Heal, and we want to hear from you.
Our question of the day is, for those of you no longer on treatment, what side effects have you experienced? Comment with your answers below and we'll write back.
Hit the subscribe button and the bell to join Team Heal. We all need teammates to support us in living a healthy lifestyle.
We're here to coach cancer survivors and caregivers on how to live healthy lives, and we want you to be part of our team of healing.
We're Amy and Steven from the Heal Every Day Together channel. Check out the link below to our website and for more information. Thank you for joining us today.
Together we heal.